If you're over 60 and your hands are always cold, if your feet take forever to warm up at night, if you feel that heavy, sluggish fatigue in the afternoon, I want you to pause right now, because this may not be just aging. My name is Dr. Christina Serrati, and I've spent years studying circulation, mineral metabolism, and vascular aging. And what I'm about to tell you might completely change how you see your symptoms. Most people are told that getting older automatically means stiff joints, brain fog, cold extremities, and rising blood pressure. But biologically, that explanation is incomplete. Think of your arteries like flexible garden hoses. When you're young, they expand easily. Blood flows smoothly. Oxygen reaches your brain, muscles, and organs without resistance. But over time, something begins to change. Those soft hoses start to harden, not because you turned another birthday, but because something critical is missing. Here's what most people never hear. Calcium does not cause problems by itself. Calcium becomes dangerous when it goes to the wrong place. You've probably been told to increase calcium for bone strength. And that advice makes sense on the surface. But without the proper guidance system inside your body, calcium doesn't always stay in your bones. Instead, it can slowly deposit into your arterial walls. When that happens, your once flexible blood vessels begin to stiffen, a process called vascular calcification. And stiff arteries mean poor circulation, increased blood pressure, reduced oxygen to the brain, cold hands and feet, fatigue that feels mysterious. This isn't grease clogging pipes, it's mineral misplacement. And the most shocking part? Many people are unknowingly deficient in the very nutrient responsible for directing calcium where it belongs. This forgotten nutrient acts like a traffic controller inside your bloodstream. Without it, calcium wanders. With it, calcium is escorted safely into bones and kept away from arteries. When this system fails, aging seems to accelerate. When it works properly, circulation can dramatically improve. Now, I'm not saying age doesn't matter, but am saying this. What many people accept as normal aging is often unmanaged mineral imbalance. And in the next section, I'm going to explain why most multivitamins don't solve this, and may even be giving you the wrong forms entirely. Before I continue, tell me, let me ask you something honestly. How many years have you been taking a daily multivitamin? 5, 10, maybe even 20. Most of my patients over 60 tell me the same thing. Dr. Serrati, I take my vitamins every single day. I'm doing everything right. And I believe them. But here's the uncomfortable truth. I discovered while reviewing clinical data and supplement manufacturing standards, most multivitamins are built for marketing, not absorption on the label. Everything looks impressive. Magnesium, calcium, vitamin K, vitamin D, a full alphabet of nutrients. But what matters is not what's printed on the bottle. What matters is what actually gets into your bloodstream. Many large supplement companies use the cheapest mineral forms available, not because they work best, but because they're inexpensive to mass produce. For example, certain forms of magnesium are poorly absorbed. They pass through the digestive system with minimal uptake. You swallow the pill, but your cells never receive the message. It's like mailing a package without a correct address. The delivery never arrives. And here's where it becomes more serious. For people over 60, as we age, stomach acid decreases, digestive efficiency declines. Nutrient absorption becomes less effective. So if you're already taking a poorly absorbed form and your digestive system isn't operating like it did at 30, you may be functionally deficient even while supplementing daily. This is what I call hidden deficiency. You think you're covered, but your arteries, muscles, and brain are still missing what they need. And then there's the second misconception that dominated medicine for decades. Fat is the problem. For years, patients were told that dietary fat was clogging arteries like grease in a kitchen pipe. So butter was replaced with margarine. Eggs were avoided. Everything became low fat. But when I began reviewing vascular imaging studies and pathology reports, I saw something different, yes? Plaque exists, but arterial stiffness in older adults often involves calcification, hardened, mineral deposits embedded in vessel walls. That's not grease, that's stone. And stone doesn't melt by cutting fat. Stone forms when calcium loses its guidance system, which brings us back to the missing piece. Because without the proper mineral partners, calcium has nowhere intelligent to go. And when arteries stiffen, the heart has to pump harder. Blood pressure rises, circulation slows. Oxygen delivery drops. You feel colder, slower, foggy, older. But this isn't inevitable decline. It's misplaced minerals in the next part. I'm going to explain why your doctor may have never mentioned this and why the medical system moves slower than the science. Asterisk, I want to address something directly. If this mineral imbalance is so important, why hasn't your doctor emphasized it? That's a fair question. And as someone who works closely with medical research, I want to answer it honestly without blaming physicians. The truth is this: medical science moves slowly, very slowly. When new research is published, it doesn't immediately change clinical guidelines. There's a long gap between discovery and daily medical practice. In fact, studies estimate that it can take 15 to 20 years for research findings to become standard care. Think of it like steering a massive cargo ship. You don't turn it quickly. It takes time. Doctors are trained to follow established protocols. Their primary responsibility is to stabilize immediate risks, high blood pressure, clotting risk, heart attack prevention. And medications are powerful tools for that. But medications often manage symptoms. They don't always correct upstream nutrient imbalances. And here's something else most people don't realize. Medical school spends surprisingly little time on advanced mineral biochemistry and nutrient synergy. Doctors receive excellent training in pharmacology and disease management, but nutrition science evolves constantly. And it's not always the centerpiece of clinical visits. That's not negligence, it's structure. Your physician is working inside a system designed for efficiency and safety. Appointments are short. Decisions must be quick. There isn't always time to explore deeper mineral dynamics unless something extreme shows up on lab work, and mineral imbalances don't always scream. They whisper: cold hands, brain fog, mild blood pressure increases, leg fatigue, joint stiffness. These don't always trigger alarm bells. They're often labeled as normal aging. But aging itself is not a disease. Reduced elasticity is not the same as inevitable decline. Now, before we go further, we need to talk about safety, because this part is extremely important. Some of you watching may be taking blood-thinning medications like warfarin and Jantivin Eliquis. These medications interact directly with vitamin K pathways in the body. And if you suddenly increase certain forms of vitamin K without supervision, it can interfere with how those medications function. That's why I always say, never introduce targeted supplementation without discussing it with your healthcare provider, especially if you are on anticoagulants. This isn't about replacing your doctor. It's about having a better conversation with your doctor. If you decide to explore this, you simply ask, "Doctor, I've been reading about vitamin K2 and arterial calcification. How would this interact with my current treatment?" That opens a safe, monitored dialogue. Also, if you have advanced kidney disease, mineral balance becomes even more delicate. The kidneys regulate calcium and magnesium levels. Supplementing without guidance in severe kidney conditions can be risky, so we move intelligently, always. Now that we've cleared that up, in the next part, I'm finally going to reveal the specific mineral pair that acts like a guidance system for calcium and why they work best together. Now we get to the core of it. The mineral most people are missing isn't calcium, it's vitamin K2. And the partner that makes it work effectively is magnesium. Let me explain why this combination matters so much. Inside your body, calcium is constantly moving. It travels through your bloodstream every single day. Its job is to strengthen bones and teeth. But calcium cannot decide on its own where to go. It needs direction. This is where vitamin K2 comes in. Vitamin K2 activates specific proteins in your body, particularly one called osteocalcin that binds calcium and pulls it into bone tissue where it belongs. It also activates another protein that helps prevent calcium from depositing in arterial walls. Without adequate K2, calcium can circulate freely and settle into soft tissues. Over time, this contributes to arterial stiffness. Now, here's where magnesium enters the picture. Magnesium is involved in over 300 enzymatic reactions in the body. But for circulation, its most critical role is this. It helps vascular smooth muscle relax. Your arteries are not rigid tubes. They are muscular structures. They contract and expand with every heartbeat. Magnesium allows them to relax properly. When magnesium is low, arteries remain tighter. Blood pressure rises more easily. Circulation becomes restricted, oxygen delivery drops. So think of it this way. Magnesium keeps the highway wide. Vitamin K2 keeps traffic moving in the right direction. When both are sufficient, calcium strengthens bones instead of stiffening arteries. Now you might wonder, if this is so important, why are so many people deficient? Two major reasons. First, modern farming practices. Decades ago, livestock consumed grass rich in vitamin K1. Animals naturally converted that into vitamin K2. When people consumed grass-fed dairy and meats, they indirectly consumed K2. Today, much livestock is grain-fed. The conversion process is dramatically reduced. Second, soil depletion. Magnesium levels in agricultural soil have declined over time due to intensive farming. Crops grown in mineral-poor soil contain fewer minerals. Even if you eat vegetables daily, you may not be getting optimal magnesium levels. This is particularly important after age 60 because absorption efficiency decreases. Now, let's be specific about forms. For magnesium, the form that is generally best tolerated and well absorbed is magnesium glycinate. It is gentle on the digestive system and less likely to cause loose stools compared to cheaper forms. For vitamin K2, the preferred form for circulation support is MK7. This version remains active in the bloodstream longer than MK4, meaning it provides more consistent activation of those calcium-regulating proteins. But dosing and timing matter. And that's exactly what I'll walk you through next, including what you may notice during the first 30 days. Now that you understand the why, let's talk about the how. I always tell my patients, never start something blindly. Track your body, observe it, respect it. So before beginning any mineral correction plan, I recommend a simple self-check. Ask yourself, do your feet stay cold long after getting into bed? Do your fingers feel stiff or tight in the morning? Do your legs feel unusually heavy when walking? Has your blood pressure slowly crept up over the years? Do you notice small, hard nodules near joints or under the skin? These aren't diagnoses, they're clues. Your body leaves patterns. Now, regarding a structured approach, many clinical reviews suggest that adults over 60 often respond well to consistent daily intake within safe, commonly used ranges. For vitamin K2 MK7, many practitioners use around 100 to 200 micrograms daily. For magnesium glycinate, total daily intake commonly falls around 300 to 400 milligrams, depending on dietary intake and physician guidance. But here's something extremely important. Vitamin K2 is fat-soluble. That means it needs dietary fat to be absorbed efficiently. If you take it on an empty stomach with water alone, absorption drops significantly. Always take it with a meal containing healthy fats, such as eggs, olive oil, avocado, or yogurt. Magnesium, on the other hand, is often best taken in the evening. Why? Because magnesium promotes muscle relaxation. Many people report improved sleep quality when taken before bed. And nighttime is when your body performs much of its repair work, including vascular maintenance. Now, what might you notice during the first 30 days? Week 1. Some people report subtle mental clarity improvements. This may relate to improved vascular relaxation and oxygen delivery. Week 2, you may notice your hands and feet warming more easily. Circulation begins responding as vascular tone improves. Week 3 to 4. Blood pressure readings may begin trending more stable in some individuals. Always monitor with your physician. Joint stiffness may feel slightly reduced. Walking may feel less heavy. Important. This is not a drug. It's not instant. Mineral redistribution takes time. Arterial calcification does not reverse overnight. But vascular flexibility can improve gradually when mineral signaling pathways are supported. Consistency matters more than intensity. And safety matters more than speed. Always recheck labs if you are on medications. Always inform your physician, especially if you take anticoagulants or have kidney concerns. This is not about replacing treatment. It's about optimizing your internal environment. In the final section, I want to bring this together and share one daily habit that could quietly sabotage your magnesium levels without you realizing it. Before we close, I need to warn you about something subtle. You can take the highest quality magnesium. You can choose the correct form of vitamin K2. You can follow everything carefully and still unknowingly sabotage your progress. There is one very common morning habit that quietly drains magnesium from the body. Coffee. Now, before you panic, I'm not anti-coffee. I drink it occasionally myself. But here's what the physiology shows. Caffeine has a mild diuretic effect. That means it increases urinary output. And when urination increases, mineral excretion increases as well, including magnesium. For younger adults with robust mineral reserves, this isn't usually a major issue. But after 60, when absorption efficiency declines and dietary magnesium intake is already borderline, daily high caffeine intake can tip the balance. This doesn't mean you must eliminate coffee completely, but it does mean you should be strategic. If you drink coffee, avoid taking magnesium at the same time. Space it several hours apart. Ensure adequate hydration. Consider limiting intake to 1 moderate cup. Also be mindful of highly processed breakfast foods. Refined sugars increase insulin spikes, and chronically elevated insulin can increase urinary magnesium loss over time. Small daily habits compound. Now, I want to step back for a moment. If there's one message I hope you take from today, it's this. You are not just getting old. Aging is natural, but accelerated stiffness, poor circulation, and mineral misplacement are not destiny. Your arteries are living tissue. They respond to signaling. They respond to nutrient availability. They respond to correction. Vitamin K2 helps guide calcium where it belongs. Magnesium helps your vascular system relax and function smoothly. Together, they support elasticity, which is one of the defining characteristics of youthful circulation. But always remember, this is a conversation starter with your healthcare provider, not a replacement for medical supervision. If you are on anticoagulants, have kidney disease, or manage complex conditions, supervision is essential. Health is not about extremes. It's about intelligent correction. My name is Dr. Christina Serrati, and I believe deeply that informed adults over 60 deserve more than symptom management. You deserve understanding. If this resonated with you, share it with someone who constantly complains about cold hands or heavy legs. They may think it's normal aging. It may not be.